A very warm good evening to one and all. Welcome back to the today's session. Today's we have our guest speaker, Dr. Jessica Monteiro, ma'am, Associate Professor from the Department of Medicine and in KLE Homeopathy Medical College, Belgavi. So the topic which will be given by the today's guest speaker is effective communication during case taking. So moving on to the small introduction regarding the guest speaker, ma'am. Ma'am has been a consultant homeopath and an associate professor in the Department of Practice of Medicine, KLE Homeopathy Medical College, Belgavi, and at around 14 years of experience in homeopathy consultation and 11.5 years of teaching experience in the homeopathy medical colleges. Ma'am has been completed her graduation in AM Sheikh Homeopathy Medical College and completed doctorate of medicine in the subject of organon of medicine from the AM Sheikh Homeopathy Medical College. And ma'am has also completed a MSc in psychology and ma'am has also completed intensive course in research methodology and biostatistics from KLE Academy and Higher Education and Research, Belgavi. Ma'am has also did certificate course in food and nutrition, and ma'am has also presented many papers in international and national conferences, and ma'am has been a resource person and a guest speaker for mind and body health and menstrual hygiene at various schools in Belgavi. We welcome you, ma'am. We welcome you all the participants to the today's session. The session is all yours, ma'am. Thank you.
Thank you for that lovely introduction and a very good evening. And I welcome all the participants and the organizers to this session today. I take this opportunity to thank all the organizers for giving me this opportunity to share on the topic, effective communication and case taking. So without wasting any time, I would like to go ahead with today's topic. Effective communication, like you know, is a pivotal and important topic in our everyday activity. If you go to the learning objectives, today I would like to define what is communication, to discuss the basics of effective communication, and to discuss the importance of effective communication during case taking. My presumption for today's webinar is probably there are many students who would be joining, and that is why my focus of this webinar is directed towards all the students who would be joining, and I am hopeful there are other staff and practitioners who are also attending this webinar. Maybe it would be a little at a lower level for them because we are only talking about basics of communication. Meanwhile, it will be a revisitation to all the others who already know about communication. I would like to start this webinar by this quote: "The most important thing in communication is hearing what isn't said." Most of us feel communication is just understanding or hearing what the other person is saying. But most of us, we fail to understand what is that something which isn't said, but is a very important or the vital part of our communication. So to all these attenders or the delegates who are there in this webinar, I would just like to put up one basic question. What do you understand about communication, or what do you feel is communication? If somebody could help me with that. You can unmute yourself and just tell me what exactly do you presume, or what is your perception about communication? If somebody could help me with that.
Ma'am, sorry to interrupt, ma'am. Actually, they can put all their answers in the chat box, ma'am, which is the question symbol over there. So
Okay.
you can just have a look over there, ma'am.
Okay, fine. So moving
Thank you.
on. Yeah, thank you so much. So moving on to the basic definition of communication, it is derived from a Latin word communicare, which means to just share or to participate. It is a process of sharing information, feelings, emotions, and values between two or more individuals. It is a process which efficiently results in a favorable change in behavior of the parties or the individuals concerned. So most of us, we feel communication is just talking or just sharing information. We fail to understand it is also a process where we are sharing, understanding mutually the feelings, emotions, and to a larger extent, even the values people share in between those individuals. So once we communicate, that is not enough. We need to effectively communicate. And when we are talking about healthcare, communication in healthcare, it is the change when we communicate, there has to be a change in the behavior between the parties or individual concerned. In our case, it is the patients. So when we are talking with the patients or we are taking a case, there has to be a change in behavior before we communicate between us as an individual, if we are students, as the students of case taking, or as an individual consultant, or there has to be change in the behavior of the patient once the communication is over. And why we are communicated, that intention has to be completed or targeted. Now, the communication process is a dynamic framework that describes how a message travels between a sender and the receiver using various communication channels. Its goal is to ensure the receiver decodes the message correctly and can provide feedback with ease and speed. Like I said, communication is a dynamic framework. It helps us to understand, decode, and encode what exactly is the message which is being communicated from the communicator and the receiver. Of course, in the later part of our session, we will see what is decoding, what is encoding. But I need all of you to understand that this is a dynamic process which is so similar what is mentioned in our case taking. Case taking is a dynamic process again, where we are trying to understand the dynamics of what the patient is trying to tell and what we are trying to understand. Good communication is a bridge between confusion and clarity. Now, why is communication important, especially for us during case taking? Because when we are communicating with our patients, most of us could be targeted with either confusion or clarity. So sometimes we have such good communication that our patients are clear of what we are intending to tell them, or we are so very clear what the patient is trying to tell us. This is one scenario. The other scenario could be there is a confusion. We are not really able to perceive what the patients are telling us, and neither do our patients are clear or of what we are trying to tell them. They are in a state of confusion. So effective communication or the good communication is a bridge, or it is something which joins and helps us to communicate with the patient. So that's a bridge between confusion and clarity. William Osler, the father of modern medicine, has quoted this. He says, listen to your patient. He is telling you your diagnosis. Why is effective communication so very important during case taking is most of us forget that when a patient is communicating to us, he is almost there telling us the diagnosis. He is there telling us what is happening to him, and this is my diagnosis. If you just if you flip around and just check it with homeopathic understanding, it's like the patient is telling us, this is my remedy. He is giving us the remedy. He is putting forth his individualization and also showing us the simillimum. So if you just flip around and just understand what the patient is telling. If we are listening to our patient well, we are there, right, getting the diagnosis. Homeopathically, we are individualizing the patient, and also to a larger extent, we are also getting the simillimum when you are actually listening to what the patient is telling and understanding. So that is very important for us, that we communicate well and effectively towards the patient. A little more on the homeopathic understanding. If you go to aphorism 1, we see the physician high and only mission is an ideal cure. It is to get a right simillimum. So here, Dr. Hahnemann is trying to emphasize that it is the physician's high and only mission. So it is our mission that we are supposed to take out all the important symptoms from the patient. And how do we take out that? Because it is our mission, it becomes very important that we use communication as a very important tool in helping us aid this mission. Again, if we go around aphorism 6, the unprejudiced observer, he says, needs to take up all the perceptible signs, the homeopath who grasps with requisite carefulness the whole group of symptoms. Again, if we divulge a little deeper into this aphorisms, Dr. Hahnemann says that all perceptible signs, the homeopath who grasps with requisite carefulness. So again, the tool for this could be a good and effective communication. And why is communication very important? It helps us it benefits both the patient and the physician. Most of us, we feel during case taking, it is only the patient who is benefiting, but it is we as the physician as well who are benefiting, because we are able to communicate well, and also we are able to individualize, diagnose, and get into the simillimum by an effective communication. When we communicate effectively, what are the things that would really happen is we would be able to build a right rapport with the patient, because all of us know building a right rapport is like giving a good start to your case taking. So it definitely helps us to build the right rapport. It helps us into going into a smoother process of history taking, again coming into the greater aspects of individualization and coming into the totality or forming the totality of the patient, which gives us or it directs us towards the right simillimum. What is the present scenario today? If you look around the healthcare scenario today, you would see that many options are available for the patients. The patients, if not you, or if not us, they have many options available so that they can go from one doctor to another doctor. There is a lot of doctor shopping, what we say. So that is the present scenario here. Second is increasing availability of medical technology. Most of us know that our patients would definitely come with a prior answer to their questions or prior diagnosis, or also they would Google their symptoms and come. So because of medical technology or in technology in general, which is available to the patients are tech savvy and they have almost all the questions and answers ready to them, and the rising expectations of the patients. So when all these put together, when we have to overcome this present healthcare scenario, one of the important tool for us medical community or our students today is having an effective communication. So probably effective communication is that one important tool which helps us, along with our clinical knowledge, good clinical acumen, our knowledge of medicine and all these other things. I think clinically and communicate, when we are able to communicate well with the patients, maybe we would be well equipped. And that is why with the present scenario, having an effective communication is the need of the hour. This is something like, the World Health Organization in the year 2012, that is 2012, they were just having a symposium as to know what is that which is decreasing the patient-doctor relationship. And the South Asian zone of the World Health Organization, they met up and they came out of different causes what is decreasing the patient-doctor relationship. And they have picked up few important tools or something called as essential tools, what is necessary to strengthen the patient-doctor relationship. They have picked up ethics, empathy, managerial skills, clinical skill, and communication skill as one of the important skill that a medical personnel or the medical community should be honing to give the right amount of care to the patient and also to increase the patient-doctor relationship. There is a framework which has been released by them, which is called as strengthening a framework to strengthen the patient-doctor relationship. And in that framework, it says one of the reasons for deteriorating doctor-patient relationship is the lack of communication skills in the doctor. He finds difficulty in talking to his patients, not because he does not want to. In many cases, he wants to, but he does not know how to talk to. So this is one of these sentences which have been put in the framework of the World Health Organization, that is WHO, which says most of our students or the medical community, they want to talk well to the patient. They find that difficulty in talking well, but what is the major problem is they do not know how to talk. So probably taking the case, when we come to our topic, it starts with taking the right case. For our student community, when we want to have a communication with our patient, it starts basically from our second year, where we learn to take the case. So it's very important that we include our communication skills into our case taking skills, so that we are able to deliver or establish a good patient doctor relationship. When we are taking the case, there are three important functions that occur. One is the content, the process, and the perception. What do we mean by content? Content is the framework what we have during our case taking. That is our case taking format. All of us know what is the case taking format. We are all taught well how to take the case, what is the format. So that's the content. So when we are talking about the content of the case, we all know what has to be taken and how it has to be taken, because we already have a framework. Now, the process is very important. The process and the perception, both of them have an important share, or communication plays a very important role when we go across, or when we move towards the process of case taking. And case taking is not a one-way process. It's a two-way communication, where we are asking and the patient, and the patient is telling us his complaint. In this process of asking and listening, there is a perception. What the patient is telling us, we need to perceive well. What we are asking the patient needs to perceive well. And this process and perception, both of them can be communicated well when we are having an effective communication skill, or we hone the effective communication skill. So now that we know that communication is plays such a pivotal role for us during our interaction with our patients, let us go into the basics of what is communication. Now, when we talk about communication, we categorize communication into three basic types, or four basic types per se. That is non-verbal communication. Like all of us know, non-verbal communication is what we communicate to the patient or the other party when we do not talk. Verbal communication is a form of communication which occurs through spoken words. So when we talk, that is verbal communication. When we do not talk and our body replaces our talking, is called as non-verbal communication. Visual communication is, it either could be a reading, or it could be some kind of pictorial form. That is visual communication. Like most of us, when we enter the clinic, we have so many visual aids that help in communicating with the patient. And finally, written communication. Written communication is when we use words to communicate our thoughts or feelings or information towards the patients. In our case, the other party is always the patient or their relatives. It's very important that we not only learn to communicate with the patient, but also communicate with the patient's caregivers or their family members. So when we are having this case taking, or we are talking with the patient, most of us, we communicate it in all the four forms of communication. We talk to them verbally. Our body language plays a very important role. Most of us, visual communication. If they are sitting in our clinic, there are so many. Our environment is something like, the pictures around us, the entry board which was there in our sitting area. All these things communicate, or it could be a pictorial form of communication. And written communication is when we prescribe to the patient. That's a very important part. So prescription, referrals, all these are part of written communication. And during a process of case taking or communicating with the patient, most of the times all the four types of communication are put into action. Today, I would like to deal a little more about verbal communication and non-verbal communication. I'm not going to go, because of laxity of time, I'm not going to go more into the written communication or the pictorial communication. But I'm going to talk a little more on verbal communication and non-verbal communication. So verbal communication, as you know, involves the use of words, either spoken, which conveys a message. It's a straight way or it's a straightforward way of communicating through language or words. Now, what are the characteristics of verbal communication? It relies on language, the vocabulary you're using, the choice of words what you are using, and how precise and clear you are. The clarity is a very important part of your verbal communication, where your thoughts are directly be communicated to the patient. Most of the times when we do not communicate effectively through our verbal communication, our patients misunderstand what we are talking to them. And if most of us experienced physicians or consultants who are already practicing knows what are the repercussions we get through miscommunication. If you just look around the medical environment today, a small miscommunication could escalate to a very larger area, which could be even seen as violence on the medical fraternity. So being very clear with the words, using the right amount of words, the choice of words what you use is really, really very important when you are communicating with your patients and their caretakers. It's not enough that only we have the right words or the language or clarity. Sometimes the tone and the pitch is very important. I will tell you in further, I'll just give you an example of a recent incident which has taken place in Chennai, where there was a medical violence on a doctor. The problem there was at the tone and the pitch and the body language. So in tone and pitch, the spoken communication, tone and pitch also influence how the message is received, such as whether the speaker seems confident or hesitant. Now, when we as a medical student are asking the patient certain question, it also depends on how confidently we are asking. When we are sitting as a consultant in our consulting room, the way, the tone, the pitch also shows the patient how confident we are or how hesitant we are. And also to a larger extent, that determines how the patient is going to respond to you. So when we are talking about verbal communication, all these things play a very, very important role. For example, in face-to-face, some of the examples of verbal communication is when you are sitting in front of the patients and you are taking a case. That's a common example of verbal communication, that is face-to-face conversation. Nowadays, we have, with the enhancement of technology, we are able to even take a case on phone, or there could be video call, Zoom call. So communicating over the phone or video chat, what I am doing to you, is also a part of verbal communication. Sometimes immediate feedback is a very important part of verbal communication, where when I am talking, you are able to immediately get a instant feedback. And why is it more efficient? Because it's more quicker than the non-verbal communication. It helps in getting the detailed information or extracting the detailed information. So verbal communication is a very important part of our case taking. As important is the verbal communication, non-verbal communication is also important. What is non-verbal communication? It is the transmission of messages without the words or without the use of words. Here it includes facial expression, gestures, posture, body language that convey emotions and attitude. Now, when we are talking about non-verbal communication, the important characteristics are kinestics, that is your hand and body movement. The way you move your hand and body movement gives a lot of information about what you are trying to say, tell the patient or extract the patient. If you are the minute the patient enters, if you just wave with the patient and you ask them to sit down just by moving your hand, that gives a larger impact on the patient. The patient knows that you are communicating with your words, and also your body language is emphasizing on what you are doing. Facial expression that can indicate many types of emotions. It could be happiness, sadness, confusion. So whenever you are talking with the patients, your facial expression is also very, very important. Next is the vocalics, that is your vocal cue. Again, like I told you, the tone and the pitch with which you are talking is very important. Haptics is something like, the body language or the body contacts, especially during case taking. When we do the general physical examination or systemic examination, this is something which is very, very important. The way we touch the patient is very important, especially in the present scenario. With ethical considerations all around, our body contacts with the patient play a very vital role in conveying important messages to the patient. So when we are examining the patient, being very, very introspective about our body contacts or haptics is a very important part of non-verbal communication. Next is the proxemics. What is proxemics? Is the spatial cues, the distance between you and your patients. That is very important in body language. Proxemics is nothing but the physical distance between two communicators, which indicate the level of intimacy or formality. So normally, if you see the slide here, there are 4 spaces of intimacy or spatial cues. One is lesser than 2 feet is called as intimate space. Most of us would not like anybody to intrude into that intimate space. So as a physician or a doctor, we are not supposed to go into the intimate space that is less than 2 feet of the patient, which may most of the time make the patient more uncomfortable. 2 to 4 feet is something which is a personal space, and 4 to 8 feet is a social space. Public spaces 8+ feet or more than 8 feet. Normally, the right amount of space, the distance between the physician and the patient or any communicator is supposed to be 18 inches. So when we are at a distance of 18 inches between our patient and us, that makes the patient to be in a more comfortable position, which is a scientifically proven distance or proxemics cue. Another very important part of nonverbal communication is eye contact. Maintaining or avoiding eye contact can give a lot of non-verbal cue to the patient. Gestures, I said, like body language, are very important part of your non-verbal communication. Again, body postures. When you are taking the case where you are leaning too far from the patient or you are standing too far, that shows that you are hostile or you are very disinterested in the patient. When your feet are too far, it says that you are ready to attack, or you are not really, you are too much of you are trying to intrude into the patient. Feet too close shows that you are very nervous, not comfortable. Folding hands against chest. You imagine yourself that you are just folding hands against your chest and taking the case. That gives a clue to the patient that you are resistant. You are not or you are not interested in what the patient is trying to tell you. Juggling with the fingers or nails. Most of us, when we are towards the end of the day and we are tired and you want to just get up from your consulting chair, you are just juggling with your fingers. You are just tapping your toes. You are just showing that you're not interested in your patient, although you may be sitting and talking to the patient. But all these body cues, body language and body posture tells the patient the either way that you are not interested, or maybe when you are using the right body language, it tells the patient that you are definitely interested and taking the case with interest, which also builds up an interest and the patient feels more comfortable, increasing the patient-doctor relationship. The touch, Another very important part of non-verbal communication is the appearance, the choice of dress which we as students or consultants wear, the color of our clothing, the hairstyle, the personal appearance is really, really very important part of our communication. We just cannot go and start taking case in a very untidily dressed manner, because that also tells the patient who is the doctor who is going to treat them. That gives the patient a very important understanding about who you are as a person. So that's very important, that we need to understand or introspect the choice of our dress, our hairstyle, our personal appearance, and all these are very, very important part of our non-verbal communication. Now, when I'm talking about skills of communicating, we need to hone the skills. Most of us say, when we are communicating or when we are taking the case, of course we have the format of taking the case, but you can divide your case taking or you're talking to the patient into three important parts. That is initial or initiating information. That is whenever the patient comes, that is the first part of gathering information, being attention to the environment, a mental preparation when the first patient leaves and the second patient is coming in. If you are repertorizing something or you are into the mobile, you need to keep that aside and look at the patient, have an eye contact with the patient and start looking, maybe give a smile to the patient. So that mental preparation is you are mentally preparing the patient and yourself to start communicating. So leaving the ongoing work for 2 minutes or 2 seconds, introducing yourself or taking an introduction of the patient. Like most of us know, we can always call the patient by their name, ask them how they are, how they have been all throughout the day, what brings them there. Some 2 or 3 sentences, informal sentences, would be really great to build a rapport with the patient. Having an effective opening question. When I'm saying initiating information, the way you open the question, the first question that you offer to the patient is something is very important, that is called as effective opening question. That goes a long way in your case taking process. A developing agenda to guide the conversation. You have to mentally develop an agenda, like you have to understand the patient within 2 or 3 minutes when the patient has come to you, and develop a mental agenda of how you are going to take the information or take the conversation ahead. So this is a very important part of your communication, that is initiating information or initiating the conversation. Once you are done with this, the second part we go is the gathering information. So these are the important parts of our case taking which we need to find the similarium. So when we are gathering information, what are the things which we need to introspect or pay attention to? One is effective listening. When the patient is talking, we need to know or be very effective in listening. I will tell you in the further slides what are the types of listening. So it is just not pretending to listen or being passively listening. Effective listening goes a long way in gathering information. Not only listening, effective questioning is also very important. So when you are listening, you also need to put the right questions across them so that you get the right answers. Like we said, Dr. Hanneman gives us good he gives us tips when we need to ask a leading question, when we need to ask open-ended questions, when we need to ask closed-ended questions. So effective questioning is very integral part of our case taking. Internal summaries. Now we are effectively listening, we are effectively questioning. That is not the end of the story. We need to have internal summaries, that is reflecting. We in some of us can call it as reflection. So what your patient is saying, you can have an internal summary within your mental arena. You can go on summarizing or picking up the important aspects of what your patient is saying, summarizing and checking at every part of the information gathering or during the case taking is very important. For example, if you have finished case taking, maybe the personal history or the preliminary data or maybe the presenting complaints, just summarizing and rechecking what you have asked within 1 or 2 questions goes a long way, that you do not miss some very important points what the patient would be or what you would be needing to gather the totality of the patient. So maybe after every part or the format of case taking, just summarizing and checking that you have finished everything may be a very important part of gathering the information. using transition and signposts. When you are talking the patient, maybe you can use your non-verbal cues, maybe you can use your tone of pitch, maybe you can just use your hand sign language. So these are the transition or signpostings which helps you in evaluating the patient's perspectives, their emotions, their concerns, their experiences, their previous experiences. And as you are doing this, you also have to evaluate the patient's information. So these are the very important part of gathering information. Now that you have initiated a very good information gathering or the initial part of case taking, you are into a good process of case taking, you have done all the part of your case taking. But if you do not close the case taking properly, you do not tell them the diagnosis, or you do not close what are the investigations required from them, or once the case taking is over, when you are talking to the patient, if you have to give them the some kind of information about how they need to take their medicines, when they have to come back for the follow up, this is called as closure of the communication. So you have to be very, very, very introspective about the closure. You have to have these checkpoints, whether I am closing the information rightly, what I have said is exactly what the patient has understood. For example, if you ask the patient to come after 1 week of your initial appointment, you need to check whether the patient has understood. Or most of us, we give so many types of medicine, maybe your BD, TID, the way the patient has to take the medicine, the kind of diet he has to follow, all these things have to be checked very primarily during the closure time. You need to provide a summary of what has happened to the patient and what are the important things he has to carry on till he meets you for the next time. Chunking the information is a very important part of the closure, because most of us know that we have patients from different type of patients, maybe literate, illiterate, different personalities of the patients from different cultural backgrounds. So if we are talking to a patient in a one way, a singular type of long conversation, maybe not all our patients will be able to understand. So chunking the information about when they need to come, how they need to take the medicine, what is the diet process. So this chunking the information is very important. And collaborative planning. Most of the time, one of the important skill of communication is collaborating with your patient, whether they want to go for a testing, whether they want to take the medicine, whatever it is, always considering them in their collaboration is a very important part of communication. There is another part of skill of communication, that is longitudinal communication. Is all throughout the case taking, that is during your opening information, gathering information, or closure, there are certain things which you have to continuously do. That is, you have to smile. You have to always show respect to the patient through your body language, the way you talk to them, the way you are sitting is very important. You cannot just keep sitting the way you want to sit. You cannot lean forward, or you cannot lean too much behind. So your body language has to be consistent all throughout the case taking. The way you sit or the way you stand, your eye contact has to be really, really good all throughout the case taking. Your active listening, your questioning, your giving explanation. One of the important, recently I was doing a research activity of knowing what is the importance of communication among patients and their relatives. Most of the questions or most of the patients came out with one of the important query is, doctor, you people ask so many questions about what is your liking. Do you like sweet? Do you like hot? Do you like cold? But we do not understand why that is asked. Probably if you give them right information during the case taking, why you are asking them about the chilliness or about their habits, probably they are in a better position to give you the right answer. So giving explanation for your probing and clarification is something that we need to understand and we need to include in our case taking. Showing empathy has to be continuously throughout your case taking, right from the way you talk, body language, verbal and non-verbal, and being very open to how you are sharing your thoughts or how the patient is sharing their thoughts. So these are called as longitudinal skills, and something is called as, the previous ones are called as sequential skills. So sequential skills that you are doing after one sequence of the other, that is initiating, gathering, closure. Longitudinal is you are continuously using these skills of communication all throughout your case taking. I'll just go ahead because of paucity of time. I'll just run through this slide. Principles of communication is your communication has to be complete, that all the message what you have to send through across the patient during your case taking has to be complete. It has to be clear. It has to be concise. It has to be courteous. You have to communicate in a friendly and a polite manner. It has to be very correct. All facts, the type, most of us, we are not able to talk in all the language what are patient, but whatever language you are talking, you have to be mindful that you are using the right words so that the communication becomes right. So using the right facts, right words, right language is very important. You have to be very concrete. You cannot be very vague with whatever you are communicating with the patient. And the most important is you have to be considerate when you are communicating with the patient. So this is called as the 7C principles of communication. Next is elements of communication. You must be aware that there are two people when you are communicating. One is the sender and the other is receiver. So the message and the channel is very important. You have to be very, very mindful about the noise, about the semantics. That semantics is how you are using those words, the channel, the environment, so that the coding and decoding happens properly. So this is very important in communication. These are the important elements of communication. There is something called as Stott-Hall's communication theory that says that when we are sending a message from the sender to a receiver, we have to be mindful about the physical context, whether the patient who is sitting in front of us is a child, is an adult, what type is it, or what is the distance between the patient. So the physical environment is something which you have to be mindful when you are talking. The cultural context, so many things are different in so many different cultures. So when you are communicating from the sender to the receiver, being very mindful about the cultural context is very, very important. What is the role in the society? In this case, it could be related to from where the patient is coming and what is his day-to-day activity. So this is very important. What is the role in the society? Next is the educational background of the patient. So when you talk to an illiterate patient, the way you communicate will be so different when you are talking from a patient who is illiterate. So all these things taking into consideration when we communicate, or when the sender sends his encodes and when the receiver decodes, these are the important parts which we need to keep in mind while communicating. And this is called as the Stott-Hall's communication theory, where the physical, cultural, the role in the society and education should be taken into consideration. Again, what is encoding and decoding? Encoding is the process of turning thoughts into communication. So all that you are wanting to ask, whatever is your thoughts, when you are converting into a communication is called as encoding. And encoding should take place into account the noise that may interfere with the message, the distraction, the influences. So you need to encode it properly. Decoding is how the patient interprets. So decoding is a process of turning communication into thoughts. So that's very important. For example, you may realize you are hungry and encode the following message to your friend. I am hungry. Do you want to get to eat something? As your friend receives the message, they decode your communication and turn it back into thoughts to make a meaning. Like when you are asking the patient, you may, you may ask your friend, are you hungry? That is a encoding. Decoding is they understand and they tell you by signs, yes, I'm hungry, or they say, yes, I'm hungry, I need to get something. So this encoding and decoding is a very, very integral part of your communication, and you should be very mindful about how you need to communicate. And apart from that, we always should be taking continuous feedback. It could be like summarizing after whatever you are communicating, all through the verbal and non-verbal cues. You always need to take the feedback from the patient during case taking. This is called as the Meherbian communication module, which is the 738 or 55 rule. What does this say? It says that 7% of what we talk is only the actual spoken words. When we are communicating with the patient, only it is 7% of the actual spoken words that is getting communicated. 38% it is how we said it. That is the tone of the voice, the modulation, the pauses that we use. So 38% is how we have spoken it. And 55% is our body language, the way we have used our facial expression, the way we have used our hand movement. So you can see the distribution of the percentage. We always feel that when we talk, that is the end of the communication, but that comprises only 7% of what communication takes between two persons. 55% is a huge chunk of our communication that happens by body language, and 38% is how you have said it. So I think it is very important that we start introspecting of how we need to communicate and what we are communicating. We only feel that using words is communication. We asking some questions of the case taking format is asking or we are communicating with the patient. It is taking into consideration, and the 738-55 rule or the Meherban communication rule is a scientifically proven theory or a rule of communication which we need to start including when we are communicating with our patients or when we are taking the case. How to effectively communicate during case taking? Like you said, active listening, proper questioning, and body language. Whenever we are taking case, we need to listen, we need to properly ask the questions, and we need to use the right body language. Now, active listening. What is active listening is, it is understanding what your patient is saying. It is listening to understand or listening to form a meaning. It will have cognitive part, the emotional aspect of it, and the behavioral aspect of it. Again, I would like to re-emphasize what William Osler said. Listen to your patient. He is telling you the diagnosis. So there is another important this of communication mnemonics. Solar is, when you have to show that you are actively listening, you have to sit facing the speaker, and which demonstrates that you are open and you are attentive. Open posture with arms and legs uncrossed. Lean slightly towards the speaker to show interest. Have a continuous eye contact and relax and avoid distracting behavior. So when you want to show your patient that you are actively listening, I think you can follow the solar technique, that is sit facing to the patient, have an open posture, lean slightly towards the speaker, have a continuous eye contact, and relax and avoid discontinuity or distraction. When we are talking about listening, I'll just run across what are the different levels of listening. One is you can ignore them. You can just, the patient is going on telling, you can be busy with something else. Pretending to listening. You are showing the patient that you're listening, but you are busy with something else. Mentally, you are not listening to them. Selective listening. You just want to, you are biased. Dr. Hahnemann says you are not supposed to be you are prejudiced. You have to be an unbiased listener. So selective listening is not what is required. We need to be open. So selective listening, taking what we need and leaving out the other thing, is not recommended. Informational listening. Most of our day-to-day active communication falls into this blanket of informational listening. We are just listening to get information. For example, this happens in our office work when we go and talk to our colleagues or when we talk to our boss. Whatever information is required, I just take that. I'm not I'm not interested in the meaning of that. But for a right case taking, reflective listening and empathetic listening, which are called as the highest form of listening, is very important. That is, you reflect what your patient is saying. You empathize with the patient when you are listening. That helps you to take the case rightly and probably get the right totality of the patient. Types of question, it could be opening question. I said it has to be very effective. Screening question is you just ask them some question to screen out some important points. Some are clarification questions. When you do not understand something, ask these questions to clarify so that there is no confusion. Probing question, when the patients, if there is one-sided case, you want to probe certain thing, probing question becomes very important. And verification question. But some two important questions you need to remember, that is a closed-ended questions and leading question. You should not ask a closed-ended question or a leading question. Always your questioning has to be open-ended question. For example, if you ask, did you like the movie? That's one example of closed-ended question. The other partner would just say yes or no. Did you like the movie? They'll say yes or no. But if you ask an open-ended question, how did you like the movie? That will give them an extra space to explain what they feel about it. So always be mindful that you are asking most of your questions which are open-ended, but sometimes leading question, probing question, clarificant questions are important, but you have to know how to use them. Also, some responses are very important. Sometimes just being silent is enough. That gives the patient enough space to talk. Empathizing by your body language, by just your vocal cues is very important. Facilitating, you are just not asking them questions all the time. You are just asking them some questions here and there, which you are facilitating them to go, especially when you are talking about mental symptoms. Just facilitating them to come out with their emotions is something which is very important. Then paraphrasing is when they are talking, you paraphrase. For example, the patient says, I feel very low today. Oh, you feel low? This is what is your paraphrasing. You're just telling them that you are listening to them. Paraphrasing is a very important part of active listening. Restatement. Sometimes you want to clarify what they are saying. So whatever the patient says, doctor, I feel that there is a burning pain. So you say, oh, there is a burning pain. So you are restating them and you are verifying. So these are the type of responses. And sometimes just by your vocalization, by just giving certain vocal cues, you can like, oh, yes, these are the some things which you need to use to tell them that you are actively listening. I just told you one. This is a newspaper cutting which I recently took from the Google, some news, Google News, in which there's a long incident, but it was a violence with one of the senior resident in a hospital in Chennai, in which they said, like, the son was not happy with the way the mother was treated, and he had there was a violence with the doctor. When the mother was interviewed, the patient and the relatives had this, they perceived as an improper treatment given to the patient. And how did they perceive? These are the two things what has been said by the patient and the relative. The patient says, Dr. Balaji did not even look at me during conversation. So the problem was not with the treatment. The problem the patient and the relative was, the doctor did not even look at me during the conversation. So that is how important we need to know the importance of non-verbal communication. And while we were talking to the patient, the doctor simply walked away. This instigated the patient to have, or there was a violent reaction from the patient's son towards the patient, because the doctor, without completing his conversation, just simply walked away. So what does this indicate? Just non-verbal communication can escalate it to a higher version. It was not that they gave us a wrong treatment or we are not happy with the treatment. The problem with the patient, this is maybe a very recent one. In the month of November, this has been taken place. So this shows how important we need or we should be mindful about our communication. So, what are the errors of communication? It could be improper tone, non-listening, wrong choice of words, inadequate information, the attitude with which we talk to our patient. These are some of the common errors which we commit while ineffectively communicating with the patient. What are the barriers? It could be a physical barrier, it could be barriers caused by wrong choice of medium. When I'm supposed to write something, you are just talking to the patient. For example, most of us, when we are supposed to write the prescription or some kind of dietic, whatever you want to give them instructions, if you just tell them, probably that's not the right medium, because after 1 week or 10 days they'll forget it. So what you want them to remember for a longer time, it is always better that you use a written mode of communication. Semantic barriers, that could be the time, place, space, noise, choice of medium. So the environmental changes. Then it could be the cultural barriers, the diversity, the different diverse cultures which you come across. That could be a barrier. You right now, one culture is so different from the other culture. Psychological or attitudinal barrier, the mood of the patient and the doctor, the relationship the patient and the doctor have, the attitude with which the doctor is talking, all these could be a part of psychological barrier. And the barriers caused by varying perception of reality, the levels of understanding and comprehension. That could be a illiterate or a literal patient would be so different while we are communicating. So these are the basic barriers of communication. So effective doctor-patient communication is a central clinical function in building a therapeutic patient-doctor relationship. This is a very central part of a case taking. This is important in delivering the high quality of healthcare. When you are able to take the right case, for us, it is very important when we give the right simillimum, probably we are able to deliver a high quality of healthcare. Many patient dissatisfaction and complaints are due to breakdown in this kind of communication. So, and one of the important part of us, most of us overestimate our ability to communicate. I did a small research where I did a descriptive study, or I took a poll, or I send a Google form, and I just try to survey what the patients and the PGs and the consultants feel about the communication. They said non-verbal is 4.14%, whereas active listening is one of the important area for improvement. But when I did a qualitative analysis, I found body language to be one of the important areas where we need to improve. So what does this research, of course this has to be yet published, but this research says when we think deeply, when we introspect, we understand how important at the level of non-verbal communication we need to be very, very introspective, whereas most of us think that we are doing the right communication. So it is a time for all of us to revisit the way we communicate during case taking, see how we are communicating with our patient both vocally and through our body language. So the take-home message for today's webinar is communication is the art of exchanging information between the people and the means of connecting to them. Like we said, case taking is an art, communication is a very important art. Good communication are the keys to success. Effective communication is the physician's most powerful tool to improve the patient care. And finally, I would end by saying, if knowledge of medicine, surgical skill, and clinical acumen is the craft of medical practice, then communication skills are the fine arts of medical practice. So thank you so much for your patient hearing. I would be open to take up any questions.
Hello.
Hello. Yes, madam.
Yes,
I am done. If there are any questions, you can please put it forth.
yes, ma'am. Respected participants, the session is open for question answer session. Yes, ma'am. I hope they have all cleared the question, ma'am.
Okay.
Thank you all. Thank you so much for the today's. Thank you, ma'am. Thank you so much for the today's wonderful session. Thank you all the participants for the active participation. And there is a little announcement over here. So, International Ayush Conference was being organized by All India Homeopathy Students and Youth Association in West Bengal, Kolkata on 12th January 2025. So, along with that, there will be a Ayush Youth Festival also. In that Ayush Youth Festival, there are many competitions will also be embedded over it. So, kindly have a look over all the links given in the YouTube chat and other in the chat box. So, waiting for all the participation. So, thank you all. Thank you so much. We'll
I think, Madam, there is one question from Professor Samir Loth. For any case in general, which symptoms must to have be emphasized? Um, can I know I mean, I'm not clear about your question. Can you please restate your question? Dr. Samir Loth? Okay. Maybe I would interpret the question as, where are the important things where we need to emphasize on the symptoms? See, there is no a formula where you need to emphasize, but being aware about what the patient is saying. From my perspective, if you take all that the patient says, like, they're presenting complaints, it could be their past history, all these things are something which it is again a case based or need based emphasis. Depends on, like, if your patient is coming, it's a case of just general, the patient is just giving you general symptoms, but you want to get more of the mental symptoms. Probably the area which the patient is not opening to, or the symptoms which are not being opened by the patient, is the area where you need to emphasize more. That is how I interpret your question. And emphasizes could be there where there is no clarity and you feel that you want more information. So that could be the area or the symptoms where you can emphasize more. I hope I have answered your question rightly.
yes, ma'am.
Yeah.
Thank you all. Thank you, ma'am, for enlightening us with the wonderful session. Thank you, participants, for the wonderful participation. And we'll be looking forward and we'll be back with the tomorrow's session. And thank you all. Good night. Thank you,
Good,
ma'am.
good night.
And we'll be thankful to our media partner, Homeo 360 Degrees. Thank you all.